Hello, I'm Professor Hazel Everitt from the University of Southampton, and I'd like to talk to you today about a trial we've undertaken looking at cognitive behavioural therapy for irritable bowel syndrome. The trial was funded by the National Institute of Health Research and undertaken by researchers here in the University of Southampton and at King's College in London. Irritable bowel syndrome is a common condition that affects about 10 to 20% of the adult population and can severely impact quality of life. People have problems maintaining their home and social life and going to work, and thus it's important that we do research in this area. Currently we have very limited treatment options for people with irritable bowel syndrome, and lots of people live with ongoing symptoms. We know that cognitive behavioural therapy is recommended in guidelines for people with irritable bowel syndrome, but at the moment those guidelines are based on research done for face-to-face cognitive behavioural therapy, and this is not very accessible at the moment because of resource constraints. This trial looked at both telephone and web-based CBT because we may be able to make this more available to people in the future. We've conducted a large randomized controlled trial of cognitive behavioural therapy for irritable bowel syndrome. We believe this is the largest trial in the world to date looking at this area. We recruited participants from 74 GP surgeries and 3 gastrointestinal clinics from London and the south of England. Participants were randomised between 3 groups. The first group received telephone cognitive behavioural therapy, and that consisted of 8 sessions of 1 hour in length over the telephone over 9 weeks, and they also had a patient manual to do with homework sessions at home. The second group had access to a cognitive behavioural therapy website and also had 2.5 hours of cognitive behavioural therapy by telephone from therapists. And the third group had treatment as usual. They were allowed access to the cognitive behavioural therapy website at the end of the trial once all data had been collected. We looked at IBS symptom severity score and the work and social adjustment scale as main outcome measures for this trial, and followed participants up for 12 months to get long-term data on whether cognitive behavioural therapy could help their IBS. Our results are exciting because we've shown that cognitive behavioural therapy can be successfully delivered by telephone or mostly on a website with patients self-managing their condition. These results graphs show our main outcome measures and how they changed over 12 months. They show that we had statistically and clinically significant improvements in the main outcome measures for both IBS symptom severity score and the work and social adjustment score. And this was also seen in our secondary outcome measures. We believe that some of the success of these treatments was because people could access the treatment at a time and place convenient to them remotely, and that actually people engaged with the treatment well, and most people did undertake the cognitive behavioural therapy. We believe that these are very positive results because we've demonstrated that both telephone and web-based cognitive behavioural therapy can provide long-term benefits for people with irritable bowel syndrome. Prior to this research, clinicians had few options to offer people with irritable bowel syndrome, but our results now suggest that increasing access to cognitive behavioural therapy for IBS could have significant patient benefit. The fact that telephone and web-based cognitive behavioural therapy can be supported remotely by therapists means that it can be spread out across many patients relatively easily. We are currently working with the Improving Access to Psychological Therapy service in the UK to make this more available for patients. We're carrying on to do further research to look at the detailed results we've got to see whether particular patient groups are more likely to benefit from either telephone or web-based cognitive behavioural therapy. We're also trying to do longer follow-up of participants to see whether the positive results we found in this trial are carried on in the long term, and to look at the cost effectiveness of providing these treatments.